Good morning to all. Today, in this small video, I am going to talk to you regarding AEFI, that means Adverse Events Following Immunization. Why AEFI is important at present? What is an AEFI and what are the different categories of AEFI? When we should suspect AEFI and how we will report to the authorities regarding AEFI, all these things will be covered in this small video. So first, what is an AEFI? AEFI is an untoward medical event that follows immunization and that does not necessarily have a causal relationship to the usage of vaccine. So please see these two parts of this definition. One thing is, any untoward event after a vaccination has to be considered as an adverse event following vaccination, and it does not necessarily mean it should be a causative factor of the vaccine, because we need more reporting so that we have to evaluate. So this adverse event may be an unfavorable or unintended sign or unexpected laboratory parameters or any symptom of the patient or any disease to the patient. So any event after an immunization is to be considered as AEFI and has to be reported when and where it is recommended. That I will come to that later. So what is the importance of AEFI? Because for pediatricians, most of the pediatricians knows regarding this AEFI because most of the immunization is going on in pediatric practice, and all these adverse events we are capturing to identify any problem to any vaccine. Why this is important? Generally also, immunization is a public health phenomena and community is always worried and importantly looking into that. So any suspicion or any doubt or any concern of the public has to be answered regarding the side effects of immunization, so that all immunization activities are followed up regularly to identify AEFI. And this is one important part of immunization safety, and with this AEFI process we are actually giving confidence to the community and to the parents and individual that immunization is a safety phenomenon. Even though we are telling immunization is very safety and very safe process, very rarely even serious reactions can occur due to this immunization. During this era, in the context of COVID-19 vaccination, there are so many discussions are going on in the various platforms like media as well as in social media regarding the safety and efficacy of COVID vaccine, especially different vaccine. So it is the responsibility of the administration to give confidence to the community, saying that we were able to surveillance all vaccination persons and identified these are the events occurred after vaccination, and almost all events are not a serious events or nothing related to immunization. To recommend these things as well as to improve the immunization safety, we required a very good AEFI reporting. So what are the different categories of AEFI, that is adverse events following immunization? Broadly, they can be classified depending upon the severity or seriousness. Common minor reaction. You know, whenever you are taking a vaccine, you will get fever, myalgia or some body symptoms, mild symptoms, which will be automatically recovered within 1 or 2 days. And sometimes you may take some paracetamol or simple homely measures. This will be grouped under the minor reactions, and serious and severe reactions may need, once in a while can occur, which may need a hospital admission or which can cause a life-threatening event, has to be reported properly. So what is a serious AEFI? which has to be reported is classified based on the 5 criteria. Most important thing is any reaction which causes death, any reaction which causes a life-threatening attack, any reaction which causes need a hospitalization or a prolongation of the hospital stay, or any reaction which causes a person a permanent or a severe disability, or any reaction which causes a congenital anomaly or birth defect. All these 5 groups, that is a death, life-threatening attacks, hospitalization, persistence or a disability or a incapacity, or congenital defect or birth defect, will be considered as serious reaction. Most of the people interchangeably use the severe reaction and serious reaction interchangeably. But actually, these are different. Serious reaction is a programmatic definition where we are considering all these 5 situations under serious headings which has to be reported to the health system. Whereas severe reaction is actually gradation of the symptoms. A fever can also be mild or fever can be severe but may not be serious. Similarly, some even mild reaction can also be sometimes serious because it may have to cause the hospital admission or vice versa. So this is very, very important. So naturally people will ask which all types of AEFI has to be reported. All serious reaction is mandatory to report. There is no doubt about that. All serious reaction which I told, a cause leading to death, leading to life-threatening attack, hospitalization, person having disabilities as well as congenital anomaly has to be reported. Second thing is a cluster. Cluster means 2 or more similar type of cases from a vaccination site or a vaccination booth will be considered as a cluster. But naturally a question came during this COVID era. So many people are getting fever. So definitely 50% all will get fever. So more than 2 people are getting fever. So we should report as a cluster. No. There's some logic you have to identify. Common minor reactions, you don't have to take it as a cluster. Some rare reactions or rare some untoward events, some unexpected phenomena, some immunization reactions, these type of things, if 2 or more things are happening in a booth or in a situation, you have to consider as a cluster. Clusters always has to be reported. Third thing is signal and events. What do you mean by signals? Signals means we know that COVID-19 vaccine or any pediatric vaccine will have some adverse events. COVID-19, we know we will get fever, we will get myalgia, we will get joint pains, we will get weakness, tiredness, etc., which will be disappeared within 24 to 48 hours. Apart from that, unexpected and unexplained symptoms occurring after COVID vaccination, which has not described anywhere, like sudden visual loss, or sudden hearing loss, or sudden numbness in some areas. These type of some unexplained phenomena are called signals and events, which has to be carefully followed up to see that whether it is a new adverse effect of this vaccine, especially in COVID-19. Fourth thing is even if it is a small minor event or a minor reaction, if community or media is considering as a significant reaction and there is some community concern regarding that, you can report where the AEFI committee, district level, state level, etc. will discuss these things and finally coming into a conclusion that what is the cause of this AEFI. Along with that, especially in the newer vaccine like COVID-19, any unexplained disease or phenomena within 28 or 30 days of the vaccine also has to be reported. This is very, very important, especially nowadays we have started the COVID vaccination. So there are so many health workers are taking the vaccine. In next 30 days, they can develop any symptoms or signs. They will come to the hospitals. So always you should ask regarding the COVID-19 vaccination status. if their symptoms are not explained by other reason. For example, if minor flu, it's okay. Mild viral fever, it is okay. Or already a child is having a bronchial asthma, he is getting a bronchial asthmatic attack, it's okay. Diabetes patient getting hyperglycemia, it is okay. But so far nothing was there. Sudden a new symptoms, new disease or a new exaggeration of symptoms, anything is there in next 30 days of the vaccination has also to be reported. All these considered has to be done in the AEFI reporting form. So always there is a confusion. Only the serious events, clusters, signals, etc. only has to be reported or investigated. Actually, these cases needs a reporting, detailed investigation, as well as a causality assessment will be done in the district and state level to identify what is the cause of this side effect, whether we have to include it in the vaccine side effect or we have to include it in the coincidental or some other cause. In the context of COVID-19, all adverse reaction after vaccination, that is minor, serious as well as severe vaccine reactions, has to be reported through COVID applications. The vaccinators can report through their vaccinator node. Similarly, DIO can also report through their login in COVID applications. But serious and severe vaccine reactions has to be reported through proper case investigations, case reporting form, and within 48 hours to the DIO, and these severe and serious reactions has to be investigated by the concerned persons, and the case investigation form has to be filled for all these serious and severe reactions. Now, another type of categorization of AEFI is based on the classification or etiological classification. So, what are the situations where AEFI can come? Every doctor should know all these things, then only they can do a very good eventual reporting. So that what we expect from the report, we will get from if you know all these classifications. So basically AEFI can group under 5 categories. First category is a vaccine product related reaction. Vaccine product related reaction means, all of you know DPT vaccine we are taking for so many years. Whenever you take DPT vaccine, the patient will get the child will get a fever, injection site tenderness, sometimes swelling, even sometimes seizures can also occur due to pertussis component. This is actually a product related reaction. Similarly, this COVID-19 vaccine also has got some product related reaction like fever, myalgia, etc. But we cannot classify this under these 5 headings because we don't have much larger data on that. But naturally, most of us know by this time 10 days, 15 days vaccine, post-vaccine started. We know that definitely 50% of the people are getting fever, myalgia, body ache, injection site tenderness, etc. Most probably it's a product related reaction which we have to manage in a simple way only. Second thing is vaccine quality related reaction. That means if vaccine is having poor quality, there can be some problem. Means live attenuated vaccine we are giving, and this live attenuated vaccine is producing the actual disease because attenuation is not properly happening. This is called second group of reaction, that is vaccine quality related reaction. Third thing is immunization errors. And immunization errors means can be an immunization error in the prescription of the vaccine, immunization error in the handling of the vaccine, or immunization error in the administration of the vaccine. All these things should be very, very important. A proper training for the health workers and health system is required to prevent the immunization errors. And immunization errors has to be identified early enough so that immediate corrections can be done then and there itself. So immunization errors has to be identified properly, reported properly, investigated properly, as well as corrective measures has to be taken. In the context of COVID-19, definitely there is, I am not telling it will be, there is a possibility of immunization errors because large number of vaccine booths are there, so many immunization persons are there, even though we have given training and all other manpower, definitely there is a possibility. So we should be very careful to identify early immunization errors. Fourth is anxiety related reaction. That means nothing significant has occurred, but because of anxiety, the patient or the person is getting syncope or those type of attacks. This is we have very commonly seen in pediatrics during the MR vaccination campaign because the adolescents 15 years, 14 years, 15 years, these children will get worried about the vaccine, injection, pain, all those things, and suddenly they will get giddiness and after some time they will be okay. These type of reactions also more commonly or more chance to occur in the COVID-19 mass vaccination campaign because it is a mass vaccination campaign, number one. Number two, we are vaccinating the adults more than 18 years. They are very much concerned about the vaccine. They have known something about the vaccine. Phase 3 trial, trial has been completed. Some are killed vaccine, some are not completed trials. So there are always apprehension about the vaccine. Moreover, most of the people will have some form of comorbidities like diabetes and hypertension. So these type of anxiety related reactions are also more common or more chance in this mass vaccination campaign. Fifth is purely coincidental. The coincidental is also more common to occur in adult because hypertension, MI and other diabetes, these type of comorbidities are more common in adults and complications related to these lifestyle diseases daily people are getting. So it is purely coincidental that one person has taken vaccine in the morning 10 a.m. and he got some MI or stroke or some other complication in the evening or night and he is hospitalized. So definitely this coincidental part is very, very tricky, very difficult to classify. Still we have to capture a report. Later we have to disprove that it is unlikely to be related to COVID vaccination. So these are the 5 groups of event. Again I will tell you, it is product related, vaccine quality related, immunization errors, then anxiety related reactions as well as coincidental. And after getting the reports, that means how you report the AEFI, how you will report. Whenever you are suspecting you are dealing with AEFI, this situation can come in two situations. One is you are having mass vaccination campaign and next day, second day immediately or on the same day or second day or third day you are getting some symptoms, you are contacting or the health system is contacting you and identifying you are having some reaction and you are going to the hospital by saying that I have taken the vaccine, some reaction is there. So definitely it will be reported as an AEFI, you have to report it. Second, another important thing is in next 28 days or 30 days, whenever an adult come to the casualty or admitted in any hospital with some symptoms which is unique or unexplained based on his medical history. Already I explained that. A non-case of COPD, recurrent asthmatic attack, asthma, you can accept it. But otherwise, really unexplained symptoms, unexplained disease, new disease, etc., you are suspecting that it may be related to COVID vaccination, you have to report. That period is 28 days, 1 month, or 30 days, 4 weeks or 1 month you can take. You have to report. How you will report? You are having a case reporting form, which is a simple 2-page format, very simple to write. Only few things has been asked there. This reporting format will be available in all district administration, primary health centers and all other health centers and other medical colleges and private hospitals where it is not available. Probably it will be tried to available in all these patients through the health administrations. So it is a case reporting format. So only 2 pages there. Section A is the reportee's information. Who is reporting it? So doctor or ASHA worker or a JPHN. Any person, even parent can report, any media can report, any person can report an AEFI. So that is whoever is reporting, the reportee's information is there. Second part is the person's detailed information. What's the age, what are the things, all these things are there. Second thing is details of the vaccine, which vaccine you have taken. Regarding COVID vaccine, very important thing is you have to write the make of the vaccine also, because in India 2 vaccines are available, Covishield as well as Covaxin. That vaccine name also has to be written there, and brand, batch number, everything has to be written. And section D is event. What is the event? And this case reporting form we are using for the pediatric case reporting form for last so many years. We are using a form. In the context of COVID, this case reporting form has been modified. So it is very easy. The reporting all COVID vaccine, most of the adverse effects has been included there. And they have included so many things like acute renal failure, acute hepatic failure. Most of the symptoms related has been included there. Just tick it. It's hepatic failure, renal failure, Guillain-Barré syndrome, polyneuritis. All things are there. Just tick what is the symptom the patient is admitted there. Then fifth is actually not related to the reporting doctor, that is decision taken from the administration. Administration actually DIO, District Immunization Officer, is the authority for that. She or he will see this and he has to investigate in within next few days. So that second part they will do it. So you have to report it immediately within 48 hours. Time limit given is whenever you know that it is a AEFI case, that means a unusual symptom is there and vaccine has been taken within 28 days of the symptom, then you have to immediately report it, and then the investigations will be done. The second part, that is called a case investigation form is there, which is a 6-page format, which will be done from the district administration, and DIO is the authority of that, and DIO will do the investigation in detail. Then what we will do with this will be detailed discussed in the district AEFI committee, and the important cases will be discussed in the state level AEFI committee. Again, there is a national level AEFI committee, will be discussed all these things, will classify each and every AEFI case and what is the final reason for the event, whether it is related to vaccine or related to some other thing. And there is a line list also is available with that. Line list will be completed when causation will be finally concluded. And there is also a verbal autopsy form. I think for the general doctors, the hospital and other thing, this is not that much important. Any vaccine related death has to be investigated with a verbal autopsy, which is a little bit detailed 13-page format, which will be done basically from the health services counterpart, that is DIO or a primary health center doctor or somebody will do after going to their hospital. But that also has to be completed. That is a verbal autopsy form. Then if death is there, postmortem will be done, and these findings also will be incorporated in the final identification of the cause of death. And this causality assessment of all AEFI is an important event. Previously also when we are doing regular immunization in the pediatrics, but in the context of a new vaccine, COVID new vaccine, this causality assessment is very, very important to increase the public confidence on the newer vaccine against COVID. So my humble request to all doctors, health workers and other people related to this is, if you come across any AEFI, please report so that the AEFI system can be strengthened, which will definitely improve our COVID vaccination program. Thank you very much.